Hi, my name is Jetta Tobacco. I am a senior at Red Cloud High School, and I have recently watched your video where you discussed health disparities and you stated you want it to be inclusive of all communities, diverse, and especially the most vulnerable, which we have known to be Black and Brown communities. And of the Black and Brown communities, we often overlook incarcerated folk. I have recently saw a documentary in class and it was primarily on the folk incarcerated at Rikers Island. They had stated that they were kept in the dark to the extent where masks and other safety measures were not immediately mandated, nor was any information about the pandemic was given. And these are my people, your people, our people, as Black and brown folk are incarcerated at the highest rate and make up a large proportion of those incarcerated in the US. So my question to you is, when will they be as equally protected?
Thank you for that question, Jetta. It's very insightful and quite poignant insight and question. You're right. This has been one of the devastating consequences of this pandemic. It's laid bare a number of inequities in our society. As you described, with greater cases, hospitalizations, death in communities of color, African American, Latino, American Indians in particular, that have been devastated by this pandemic. Those systemic processes of inequity and inequality not only involve health, but sometimes they reflect other institutions, and whether that's our criminal justice system, our healthcare system, our educational systems. And so these are often converging in this pandemic. As you described, there's a particular vulnerability of individuals who are incarcerated, obviously a closed exposure environment to the virus, and probably an insufficient level of testing and surveillance, as well as the distancing and mitigation strategies necessary to control these elements. This is both a challenge, but something that can be intervened upon. And certainly as a research agency, part of it is helping to develop those strategies. And so there are research efforts that are underway. Notably, it's called RADx Up. I won't get into the acronym, but to say that these underserved and vulnerable populations are a particular focus area for the NIH, of which incarcerated individuals are almost by definition a vulnerable population, and looking at different strategies to develop better testing, better surveillance in these populations. Similarly, there are studies underway to look at vaccination within that context, given the high exposure. And so those individuals at greatest risk may actually derive the greatest benefit from some of the research efforts, and perhaps represent an opportunity for research that not only helps us get information reflective and beneficial to all society, but particularly may also benefit those most vulnerable. So I appreciate that question and that sensibility that we, I think in many ways, as the history is written, will be judged by how we treated the least of these, the most vulnerable in our population, and how we're able to protect them.